musculature is divided into two parts, which are intrinsic muscle and extrinsic muscle. And I will explain about intrinsic muscle first. Intrinsic muscle is the structure and position of the larynx that important for a variety of functions, including phonation. There are four categories of intrinsic muscle, which are open vocal cord, or known as abductors, closed vocal cord, or known as adductors, control tension of vocal cord, and the last one is alter shape of laryngeal inlet. Posterior cricoarytenoid is the only abductor of the larynx, and it is also known as the tensor of vocal cord. It arises from the posterior surface of the cricolamina and spreads out to be inserted into the posterior aspect of the arytenoid's muscular process. The points of the vocal process are rotated away from each other during contraction, which opens the vocal cords. Intraoretinoid and lateral cricoarytenoid is two types adductors of the larynx. Intraoretinoid is divided into two muscles, which are oblique arytenoides and transverse arytenoides. Oblique arytenoides is superficial to transverse arytenoid. It originates from the posterior base of the muscular process and runs obliquely to the opposite arytenoid's apex. It also enables adduction of vocal cords. For transverse arytenoides, it stretches the posterior surface of both arytenoid cartilage. The purpose of this mechanism is to pull the two arytenoids closer together and approach the vocal cords. Lateral cricoarytenoid originates on the cricoid cartilage superolateral surface. It attaches to the muscular process of arytenoid cartilage. When contracted, the arytenoid cartilage sways inward and downward, the vocal cords adduction, and the muscular process are pulled forward. Control tension of vocal cord. Tensor is defined as the muscle that tenses the vocal folds. There are two types muscle of tensor, which are cricothyroid muscle and thyroarytenoid muscle. For cricothyroid muscle, the contraction pulls the thyroid cartilage down, stretching the vocal folds and raising the pitch, and it also the primary tensor of the vocal cord. It composed of two heads, which are pars recta and pars oblique. Pars recta to cause up and out to insert into the thyroid's lamina lower surface, and for pars oblique is to rise up to the junction of the thyroid lamina and the inferior conum. While for thyroarytenoid muscle, it forms most of the vocal cords, occur inside the lower part of the thyroid cartilage angle and passes posteriorly as a triangular band and is attached to the vocal process and anterior surface of the arytenoid cartilage. It narrow band of medial fibers running parallel to the vocal cords. The wide transverse part of the triangle forms the lateral wall of the larynx and part of the ventral fold. Vocalist muscle is a part of the thyroarytenoid muscle. It derives from the inner surface of the thyroid cartilage inset to the lateral surface of the arytenoid. The contraction tightens the vocal cords and the contraction relaxes the vocal cords. Alter shape of laryngeal inlet is divided into two muscles, which are aryepiglotticus and thyroepiglotticus. Aryepiglotticus is act to closure of the laryngeal inlet, and thyroepiglotticus act to narrowing the laryngeal inlet and adducts the vocal.
There are three types of extrinsic laryngeal muscles, which are infrahyoid, suprahyoid, and the stylopharyngeus, which is a muscle of the pharynx. The infrahyoid muscles are a group of four paired muscles that are located in the anterior aspect of the neck, inferior to the hyoid bone. It is also known as the strap muscle. The infrahyoid muscles are divided into two layers. First, superficial layer, which is sternohyoid and omohyoid. Second, deep layer, which is sternothyroid and thyrohyoid. First is omohyoid. Omohyoid attached to the omohyoid's inferior belly. It is located superiormedially beneath the sternocleidomastoid muscle, and the superior belly ascends from here to join the hyoid bone. The action is to depress the hyoid bone. Sternohyoid. It is derived from the sternum and the sternoclavicular joint. It ascends to join the hyoid bone. It also depresses the hyoid bone. Third, sternothyroid. Sternothyroid arises from the manubrium of the sternum. It attaches to the thyroid cartilage. It also depresses the thyroid cartilage. The last one is thyrohyoid. It arises from the thyroid cartilage of the larynx and ascends to attach to the hyoid bone. It depresses the hyoid, but if the hyoid bone is fixed, it can elevate the larynx. Next is function of infrahyoid muscles. It is for the positioning of the hyoid bone along with the suprahyoid muscles and swallowing and the movement of the larynx. All infrahyoid muscles depress the hyoid except for the sternothyroid, which is lowering the larynx. Besides that, omohyoid maintains a low pressure in the interverjugular vein, increasing blood return from the head.
My name is Nur Afka bint Adnan, and today I'm going to explain about extrinsic laryngeal muscle. So the extrinsic laryngeal muscle are subclassified as either suprahyoid or infrahyoid muscles. Suprahyoid muscle have attachment superior to the hyoid bone. Meanwhile, infrahyoid muscle have one of their attachment inferior to the hyoid bone. And the neck action of suprahyoid muscle is an elevation of the hyoid bone and subsequently the larynx. Next is, there are 6 types of muscle in suprahyoid muscle. The first one is digastricus, Thylohyoid, Hyoglossus, Genioglossus, Geniohyoid, and also Mylohyoid. And this is the structure of the suprahyoid muscle, digastricus, Mylohyoid, and Thylohyoid. Digastricus consists of 2 bellies, which is the first one is the anterior belly that has its origin inside the lower border of the mandible, and the second one is the posterior belly, originates at the mastoid process, rounded the base of the skull immediately behind the ear. If the hyoid bone is anchored, contraction of the digastricus will exist in depressing the mandible. With the mandible fixed, contraction will exist in elevating the hyoid bone and larynx bone. Next is Thylohyoid. The origin is at the styloid process of temporal bone. So the insertion is at the junction of hyoid corpus and greater cornua, and the action is to elevate the hyoid bone up and back. So the stylohyoid muscle passes from the styloid process at the base of the skull to the junction of the corpus and greater cornua of the hyoid bone upon contraction. This muscle will draw the hyoid bone and larynx upward and backward. Next is Mylohyoid. So the origin of Mylohyoid is at the inner surface of body of mandible, and the insertion is at the posterior fibers to hyoid corpus, and the action is to elevate the hyoid bone or depressor the mandible. The posterior most fibers along the midline rough insert onto the corpus of the hyoid bone. When this muscle contract, it will either elevate the hyoid bone and larynx or depress the mandible, depending upon which anatomical structure is anchored and which is not. Next is Geniohyoid. So the origin is at the lower part of mental symphysis of mandible, and the insertion is at the anterior corpus of hyoid. And the action of Geniohyoid is, with the mandible anchored, pulls the hyoid bone up and forward. It originates at the lower portion of the mental symphysis of the mandible, causes inferiorly to insert onto the anterior surface of the corpus of the hyoid bone. The contraction of this muscle will result in elevation of the hyoid bone in a forward direction. Next is Hyoglossus. Its origin is at corpus and greater cornua of hyoid. The insertion is at posterolateral surface of tongue, and the action is primarily an extrinsic tongue muscle. It may help position larynx. So it is a muscle primarily associated with the tongue, but it does have an indirect action upon the larynx by the way of the hyoid bone. Next is Genioglossus. Its origin is at the mental symphysis of mandible. The insertion is at the lower fibers to hyoid, which is upper fibers to inferior tongue, and the action is primarily an extrinsic tongue muscle. It may also help positioning larynx. So it runs in posterior direction, upper fiber insert into the inferior regions of the tongue. This muscle is primarily associated with the tongue. It may play a part in positioning the larynx in much the same way as the Hyoglossus muscle.
Theories of phonation is divided into two, which are aerodynamic myoelastic theory and cover body theory. I will explain about aerodynamic myoelastic theory first. Aerodynamic myoelastic theory is proposed by Van der Berg at 1950. Vocal cord is vibrate based on myoelastic and aerodynamic. Myoelastic is the elastic component of the muscle, and aerodynamic is the pressure and airflow via constricted tube. The vocal folds return to their natural position after being distended due to the tissue elasticity, as well as the Bernoulli effects, which aids this return by lowering pressure at the constriction.
Next is the body cover theory. This theory developed by Hirano in 1974. The modest attempt to explain the extreme variability in sound production. He also described the Thyroaretinoid and cricothyroid muscles as the major determinants of vocal fold shape and stiffness. The next slide we will look at the model explained. First, cover. Epithelium and superficial layer of the lamina propria. Second, transition, intermediate and deep layer of the lamina propria. Third, body, which is vocalis muscle. Next, two primary layers, which are cover and body. Cover is stratified squamous epithelium and the superficial layer of the lamina propria. It is the surface of the folds. Second, body. Body is the intermediate and deep layers of the lamina propria. It is stiffer and has active contractile properties. It is deeper in the fold. Its layers change in stiffness by different muscle activity. Next is the detail for the body cover theory. The vocalis muscle provides the firm body of the vocal cord, over which the mucous membrane cover of the vocal cord is blown by the expiratory air system. In one vibratory cycle, the periods of vocal fold contact and lack of contact can be broadly divided into closed and open phases. The closing phase of the vocal folds moves faster than the opening phase. Characteristics of vocal fold vibration are dependent on length, elastic properties, and mass distribution. For the body contraction, the cover becomes shorter and thicker, giving more mass to the length unit. The cover is entirely passive. Longitudinal state is specified by its length and lateral displacement depends on the thickness of its body. These are the phases of the body cover theory. First, closing. The vocal folds begin to close rapidly from their lower margins. Closed phase, the medial edges of the vocal folds are in full contact. For the opening phase, the superior margin remains contact until the end of this phase. For the open phases, the vocal folds are separated, the longest part of a normal vibratory cycle.